Hi everyone, thanks for listening to my presentations. Today I'll be talking about adrenal insufficiency symptoms and signs, and this will form part 3 of 7 when it comes to adrenal insufficiency series of presentations. If you haven't listened to parts 1 and 2, please kindly do. Okay, with that, let's go. Symptoms and signs would depend on the rate of loss of adrenal function, the depth of the severity, preserved mineralocorticoids or not, the degree of the associated stress, and whether or not we have the precipitants and the precipitants have been addressed or not. So let me explain myself further here. If the rate of loss of adrenal function is very fast, the crisis will be turning to Addisonian crisis. But if it is slow and the depth of the severity is not that much, it will be Addison disease without obvious Addisonian crisis immediately. If there's no preserved mineralocorticoids, then we're running into a greater problem. And stress could be the culprit, and the greater the stress, the worse the presentation. If precipitants are not diagnosed and not addressed, then the symptoms will persist. In primary adrenal crisis, we'll be dealing with shock, anorexia, nausea, vomiting, abdominal pain, weakness, or fatigue. Also, we'll be having dehydration, decreased blood pressure, unintended weight loss, hypoglycemia, fever, and hyperpigmentation. Vitiligo is likely going to be present. Okay, in central adrenal insufficiency, it means there will be problem with the hypothalamus affecting the pituitary gland. Remember, I've said that in the endocrine system, we have hypothalamic-pituitary adrenal axis, like we are dealing with right now on the adrenal system, right? We can have hypothalamic-pituitary thyroid axis, and that will handle thyroid hormones. Hypothalamic-pituitary gonadal axis will handle the ovary and testes. Now, the head is in trouble, and the whole body will pay for that. The same is applicable here. When there's problem with hypothalamic-pituitary connection, there will be decreased ACTH when it comes to adrenal axis. But mind you, since the head is in trouble, since the brain is in trouble, since the hypothalamus is in trouble right now, the entire body will pay for it. Infertility, because it will affect hypothalamic-pituitary ovarian axis or hypothalamic-pituitary gonadal axis generally. So there will be infertility, amenorrhea, decreased libido in women, irregular menses, hallucinations, and when it is affecting hypothalamic-pituitary thyroid axis, there will be hypothyroidism. When it's affecting the growth hormone, there will be decreased growth. And of course, pituitary apoplexy will give headache and decreased visual field. Okay, the central adrenal insufficiency will give us fatigue, arthralgia, myalgia, lethargy, confusion, delirium, stupor. Still on central insufficiency, the individual could go into coma or death if no intervention immediately. Some will have mania. There might be active illness in some with infection. In chronic cases, of secondary adrenal insufficiency and tertiary adrenal insufficiency, the individual could be having weakness, tiredness, fatigue, anorexia, postural dizziness, and nausea, vomiting with diarrhea. Still, in chronic cases of secondary or tertiary adrenal insufficiency, the individual could be craving salt or salt-rich foods, muscle and joint pains, weight loss that is not intentional, and auricular calcification. Okay, now signs in primary adrenal insufficiency. Remember, we've covered the symptoms, right? Even from part 2 of this series, I have covered some symptoms as well. So you can review that. Now, signs are what we, the doctors and nurses, will pick on physical examination, laboratory report, or even radiological investigations. The symptoms are what the patients will complain about. Okay, so we are likely going to find decreased sodium, increased potassium, increased calcium, anemia, eosinophils at increased level or eosinophilia, azotemia, and of course, hyperpigmentation. Still, signs of primary adrenal insufficiency will include vitiligo, decreased blood pressure, increased temperature, weight reduction, and dehydration. Still, on signs of primary adrenal insufficiency, there is likelihood of auricular cartilage calcification, splenomegaly, tonsillar hypertrophy, normocytic anemia. In secondary or tertiary adrenal insufficiency, some features will be different, okay, compared to the primary adrenal insufficiency. So in secondary or tertiary, there will be no hyperpigmentation. And why that? We'll be dealing with less ACTH secretion. There will be no dehydration. And we have hypotension, but it's going to be less compared to primary adrenal insufficiency. Unlike primary adrenal insufficiency with hyperkalemia, here in secondary or tertiary adrenal insufficiency, we have no hyperkalemia. The gastrointestinal symptoms of the primary adrenal insufficiency will be less when it comes to secondary or tertiary. But we'll be having more hypoglycemia here, particularly in secondary adrenal failure. Other hormones will also be in low production here. Aldosterone. Aldosterone is from adrenal cortex. It is responsible for the absorption of water and sodium, and it will increase the loss of potassium. So we are going to have more water retained, more sodium retained, and less potassium as a function of aldosterone. Increased aldosterone is also known as cont syndrome or hyperaldosteronism from adrenal tumor. And if that is the case, we'll be dealing with high blood pressure, decreased potassium, increased sodium, and increased water retention. When we have decreased aldosterone level, we're dealing with hypoaldosteronism from Addison's disease with low blood pressure, increased potassium, decreased sodium, and decreased water retention. And with that, I've come to the end of signs and symptoms of adrenal failure. And that is the end of part 3 of 7. We'll be moving on to part 4 or 7. Please, if you haven't listened to the previous ones before now, please kindly do. And watch out for part 4. Thanks for listening. Please remember to share. Remember to subscribe. I appreciate it.